And welcome back. Dr. Christie Alexander from FSU's College of Medicine is here now to answer more of our COVID-related questions.
All right, Dr. Alexander, thanks so much for joining us today. How are you doing?
I'm doing great. Thank you for having me back.
Yes, it's always nice to see you. We are seeing numbers slowly drop, positivity rate and hospitalizations here in Florida. So what's behind the decrease and how do we really keep that trend going?
It's a great question, and it's really good to see finally the positivity rates coming down, and in addition the hospitalizations. I was talking to some of my colleagues across the state, and we all feel that it's likely due to people properly socially distancing and wearing masks as they should, and therefore decreasing community transmission. The other part of it is doing enough tests to make sure we're testing a true sample of our population across the state of Florida, and not just the sickest of the sick. So a combination of those factors for sure. As far as how to keep it going, again, continuing to social distance, keep wearing those masks when you're out and about around other people, good hand washing, all of those things still apply.
Last week we learned that Florida will take part in a vaccine pilot program. How is that going to work, and what will that mean?
Yeah, this is really exciting too. So the CDC has invited Florida, Minnesota, North Dakota, and California to be part of this vaccine pilot program. It's not testing the vaccine. The vaccine will have already been tested, but it's trying to figure out how best to distribute the vaccine once it's available. And with our population being so big and so varied in our state and California, rural North Dakota, for example, where there's more of an indigenous population, we can best decide how that vaccine should get distributed. So that's what we're looking at with that, and it's great because everybody's being proactive with this, so that when that vaccine is available, we know how to distribute it best. You can think about Florida, for example, in our nursing homes. That would be one place to start if you're looking for an example of what that might look like, or our healthcare workers, or which population should it go to first. And then that information will be sent back to the government for them to make the big decisions for our entire nation.
Okay, and Dr. Alexander, there's new research on the virus and how it spreads through air. What can you tell us about the findings?
Yes, so some researchers at the University of Florida were doing studies on aerosolization of the virus. Is it just respiratory droplets that drop, before they get to 6 feet, or does it go farther? And they found that in hospitalized patients, they could isolate virus at distances of 7 to 16 feet. Now, they only were able to isolate 74 virus particles. We still don't know how much virus it takes to infect somebody, but this is in a hospitalized situation where ventilation is really, really good. So even in good, well-ventilated areas, they were able to isolate that virus at those distances, making us think that it is possibly aerosolized. This was not peer-reviewed yet, so we do need more research around this, but it is giving us more information as we move forward.
Okay, local schools are starting to reopen, and we've already seen some teachers and students test positive. So what are the best practices on handling a positive case in a school, and should the whole class then quarantine?
It's so tough, right? Because of course we don't want anybody to get sick. We certainly don't want anybody else to get sick. So the probable thing that will happen, and it's going to be district to district, school to school, everybody has their own policies, but if somebody were to get sick and test positive for, or should specifically test positive for COVID-19, that person and everybody around them should quarantine for 14 days to see if they develop symptoms and just to keep other people safe. So it may be that the classroom isolates, it may be just a few people that person was around. It really depends on how that classroom is set up. But yes, the short answer is that likely that group of people will have to at least quarantine for 14 days to make sure that the spread stops there.
Yeah, that makes sense with that study that you just talked about the virus possibly being aerosolized. Florida State going ahead with its football season. Yesterday they put out tailgating guidelines. What are your thoughts on tailgating, and do you think it's safe?
Well, yeah, that's a really tough question because The short answer to that is I really don't think it's safe. When we think about when summer came upon us and everybody wanted to get back to the beaches and all of the people that were so close proximity there, it's going to look the same at a tailgate. If anybody's ever been to a tailgate, it's so hard to socially distance in those situations. And certainly you're going to have to take off your mask to eat or to drink. So whether it's water or a beer, so then you're not protected by the mask in those events. So I just, again, really weigh the benefits versus the risks of these things and make those decisions for yourselves whether it's a good idea. As much as I love a good tailgate, I won't be tailgating this year.
Yeah, okay, I think we'll leave that right there. You can see the stipulations Florida State has on its tailgates on their website, the athletics department website, that is. Dr. Alexander, is there anything that you would like to add before we let you go?
Just one more thing, flu season is upon us, and so flu vaccinations should be available very, very soon if they're not already at your physician's offices or pharmacy. So I strongly recommend you get that this year to avoid getting the flu while all of this COVID is going around.
Yeah, that does not sound like that would be fun. It definitely wouldn't be good for anybody involved in that, right? All right, Dr. Alexander, thanks so much for joining us today. We appreciate you.